So the thing is, when it comes to a diabetic type 2 patient, and when it comes to either having a grapefruit or an orange, okay, you're gonna be better off if you serve your patient, in this case is my wife, with a grapefruit. Okay, a grapefruit is gonna be much better than an orange. Okay, let me show you the orange. These are Florida oranges. Okay. For different reasons. The best reason is going to be that with a grapefruit you're going to be at just half of a grapefruit. Okay, no, not a full grapefruit, just half of it, and you're going to be the next day you're going to be between 125, 130, 135, 145 at the most. Okay, when it comes to an orange, if you serve your patient an orange, not an orange but half an orange, most likely you're going to be the next day at 180, 85, 190, 195, 200, 2000, 205. You do not want to serve oranges to your patient, okay? Because it's gonna increase the level of sugar in your patient's blood, and it's not gonna be good for him or for her, okay? So. Grapefruit is going to be much better. That's the grapefruit. That's also the oranges than a regular orange. This is Florida oranges. So God bless you all. Okay. See you.